Welcome to Harris Health Dialysis. This is a phosphorus education video brought to you by our clinic dietitians. Hello there, my name is Edlyn and I'm a dietitian here at Harris Health Dialysis Center. Today, we are going to learn about phosphorus. What is it? Why is it important to control your intake of it? And what foods contain phosphorus? Phosphorus is a mineral found in all foods, more so in processed foods. Phosphorus works great with calcium and vitamin D to keep bones healthy and strong. Phosphorus also helps keep blood vessels and muscles working well. You may ask yourself, what is the goal of my phosphorus level? The normal level of phosphorus in your blood prevents diseases of the bones and heart. Dialysis patients need to keep their phosphorus level between 3.5 and 5.5 milligrams per deciliter. Let's look at what happens when the phosphorus level is more than 5.5 milligrams per deciliter. High phosphorus causes calcium to accumulate in different parts of the body, causing wounds. High phosphorus pulls calcium out of the bones, making them weak and prone to fractures. High phosphorus also causes calcium to build up in the blood vessels, which causes heart attacks and strokes. High phosphorus in the body means your arteries can harden, leading to heart attacks and stroke. You can experience joint pain and stiffness, muscle pain or weakness. Some unsightly consequences from high phosphorus include red eyes, itchy skin, wounds that are hard to heal, painful, and soft or deformed bones and fractures. Notify your medical team if you are experiencing any of these symptoms. The best way to manage phosphorus levels is by avoiding foods that have artificial phosphorus added. Limit the amount or control the portions of foods high in natural phosphorus in your meals. Take your phosphate binder with all your meals and snacks.
Let's discuss the natural phosphorus in food. Hello there, my name is Jennifer and I'm a dietetic intern. Our bodies will absorb 40% of natural phosphorus from the grain products we consume. We absorb 60% from meat, eggs, beans, and nuts. Then 80% is absorbed from dairy products.
Hello there, my name is Han and I'm also a dietetic intern. Let's dive a little deeper into grains. Grains include foods like rice, pasta, cereal, and bread. Our bodies only absorb about half of the natural phosphorus in grains. It is important to choose more whole grains to get enough fiber to keep you healthy. It is also important to avoid overly processed grains that contain phosphate additives. We know grits are kidney friendly, but let's take a look at the nutrition label to make sure. Everything seems to look okay here. The nutrition label gives great information, but we should always make sure to look at the ingredients list too.
Do you see any phosphorus here? If you pointed at ferric phosphate, you are correct. Even though grits are kidney-friendly, instant or pre-made options typically contain phosphate additives. Grains to avoid or limit are instant or pre-made options such as these. But you can still have similar food items. Here are grains to choose more often. By making things such as bread and tortillas at home, the possibilities are endless.
Meat, eggs, beans, and nuts all have phosphorus, but they also provide a lot of protein. It is important to include protein in all your meals and snacks to ensure you maintain good protein levels. Meat, beans, and nuts to avoid or limit are highly processed or deli meats and canned beans. Avoid nuts and seeds if your potassium is elevated. Meat, eggs, beans, and nuts to choose more often are proteins such as chicken, fish, and whole eggs. Use soaking or double boiling to lower potassium in dry beans. Nuts are a great snack option in moderation. Now let's discuss dairy. Non-dairy alternatives are lower in phosphorus. Always check the ingredients to ensure there are no phosphorus or potassium additives in the product. If you're having regular dairy, limit to 1 portion per day by having a half a cup cow's milk, or 1 ounce of cheese, or a half a cup yogurt. Dairy to avoid or limit are highly processed cheeses such as queso and food items made with cow's milk like whole milk yogurt and ice cream. Dairy to choose more often are milk alternatives such as oat, almond, rice, and soy milk, with great cheese alternatives of cottage cheese, queso fresco, and cream cheese, while sorbet is a great dessert option in moderation because it's dairy-free.
Artificial or inorganic phosphorus refers to phosphorus that is found in food in the form of additives. Phosphorus is one of the many chemicals that are added to food to improve stability, taste, color, and preservation. Artificial phosphorus is bad for the health of people on dialysis. Our body absorbs artificial phosphorus completely, causing heart, bone, and skin disease. But, as we discussed earlier, our body does not absorb natural phosphorus completely. Foods that are high in natural phosphorus like whole grains, meat, beans, nuts, and dairy are healthier than processed foods with additives.
Thank you, Edlyn.
Avoid or limit highly processed foods such as packaged pastries and candy similar to these, because they tend to be really high in artificial phosphorus. You can still have sweets in moderation by choosing pastries such as angel cake. You can even add whipped cream and berries. The cookies and hard candies pictured here are better alternatives for your kidneys. Dressings, sauces, condiments, and drinks typically have phosphate additives that are easy for us to overlook. Avoid or limit these items, and remember to look at the ingredients list before consuming. We still want you to have your favorite sauces and dressings. It's best to make them at home so you're aware of all the ingredients in them. Seltzer water is a great alternative to soda, but you can also make your own flavored water by infusing fruits or have brewed tea or coffee. Avoid or limit highly processed snacks such as chips. Cheese-flavored chips typically have a higher content of phosphate additives. We understand you may love some of these options, so make sure to only have them on special occasions and only one serving. Better options for you to have on a regular basis are snacks such as unsalted popcorn, pretzels, rice cakes, and crackers. Yum! Let's take a closer look at this clear peach-flavored drink. Phosphorus is not included on the nutrition label like calories, fat, sodium, and potassium. The best way to find out if a product has phosphorus food additives in it is to read the ingredients, usually located at the bottom or side of the nutrition facts label. Do you see any phosphorus here? If you pointed at the phosphoric acid, you are correct. Even though this drink is clear, high in protein, and has zero sugar, the phosphoric acid added into it will hurt your kidneys. Since you're doing great, let's look at another product. Whoa, seems a little high in sodium for 4 crackers. Remember that salt-free crackers are the better choice. This one might be a little tricky, but I believe in you. Great job! Sodium acid pyrophosphate and monocalcium phosphate are additives. Remember that these are typical ingredients in leavening, which is commonly used in baked products. These are some common phosphorus additive names you should be aware of when reading an ingredients list. Have these saved on your phone as a reminder whenever you go grocery shopping. A great way to remember additive names is by checking the label for any ingredient that has the letters PHOS or FOS for Spanish, to avoid products that have phosphorus additives. When in the market, limit purchases of products that are on the shelves in the center. These are full of processed foods. Focus on buying the natural food that is on the perimeter of the market, such as fresh fruit, vegetables, and meat. Now, let's review what we learned today. The goal is to maintain phosphorus level between 3.5 and 5.5 milligrams per deciliter. Watch phosphorus intake, limit or portion foods high in natural phosphorus, and avoid artificial phosphorus in foods by checking the ingredients list. The most important piece of information to remember is to take your phosphate binder with everything you eat, and we mean everything. Take your binders with every meal and snack, even if it's a small or bite-sized serving. This will help maintain your phosphorus levels in a healthy range to help you live a long and productive life. Thanks for watching. Your clinical dietitian is available for guidance.
Production brought to you by UTHealth School of Public Health.